to emphasize these important questions regarding the liver cancer, and I am working vigorously on liver cancer. First of all, liver cancer is called the hepatocellular carcinoma. So, liver is made up of the hepatocyte, is a 70-80% populations in the hepatocyte. If there is a mutation on the hepatocytes, then there is a hepatocellular carcinoma. Now, hepatocellular carcinoma may come from different ways by viral infection, and all of you heard about hepatitis B, hepatitis C, and apart from that there is a genotoxic exposure, like all of you know alcohol exposure and other what Professor Dash already mentioned, that is the life changes, because day by day we are taking lot of junk foods and lifestyle changes. Those also causes the degeneration of the liver. Ultimately it is causing the hepatocellular carcinoma. So, things is that what is the current scenario in India? Of course, it is increasing day by day due to the lifestyle, and in the statistically we found that is Mongolia is the highest population, but India and China is a big trouble in terms of the liver cancer. Now, liver cancer caused by, as mentioned, by the virus, and apart from that, that is when there is a genotoxic state, that the liver has a several disease like fibrosis, cirrhosis. Now, what I want to emphasize here, that is the hepatocellular carcinoma in the cirrhotic background is a most causal problem in India other than other country, because that is in our country, that is people don't go regularly in the clinics for the regular checkup, even they don't know what's going on in their liver, right. So, in the term of that, when the people comes with the cancer with the cirrhotic background, and cirrhosis is nothing but the extracellular matrix which is deposit in the liver during the different genotoxic exposure. Now, question is that is how we can recover from this cirrhosis, otherwise in the HCC from the cirrhotic background. Now, what Dr. Moushami is mentioned, that is two kind of the treatment is we can do. One is surgical way, and apart from that the treatment base chemotherapy or radiotherapy. But unfortunately, there is no radiotherapy or chemotherapy is suitable for liver cancer. Now, in the surgical case is fine, because the liver regenerates itself and hepatocyte has a capability of regenerations. So, if it is early detection of the cancer is formed and there is a it called dysplastic nodules form, so we can do the surgery of the liver and the tumor portion is removed from the liver, and liver will regenerate and it will be curable. But if it is in case of the early detection, I can say that is 40 to 45% patient there is no problem, that is liver cancer. But if it is a late stage come, that is nothing to do, it is in the already metastasis condition. Now there is a scenario is very bad, and if it is the cirrhosis or the fibrotic microenvironment in the associated with the tumor, so there is a no issue in the treatment. Now FDA, you know about the USA, FDA approved the drugs for therapy, and one of the drug is called the sorafenib. Now, sorafenib, if you treat the hepatocellular carcinoma, people will survive maybe 4 to 5 months. That is the tragedy in throughout the world, and still in India also, that is the problem. Now, question is that is the after the treatment also the sorafenib, there is a lot of side effects. So now we have to think, and it is the better time to think about the immune therapy or stem cell therapy, and there is a lot of
for liver cancer. So these two, combinatorial immunotherapy and this stem cell therapy is coming in a big way. So could you please tell something about these three? How these?
So there is a stem cell theory. Just I want to mention that is we have a bone marrow, and bone marrow has a stem cells. There is a three kind of the stem cell: hematopoietic stem cells, mesenchymal stem cell, and endothelial origin stem cells. So when there is a damage in our body, any organs, the stem cells will recover there. That is a natural systems, right? Now we are facing problem with the chemotherapy. What Dr. Dhruv is mentioned, that is need to do combination therapy. That means damage is not completely recovering. Now if we do some mesenchymal stem cell therapy, along with this chemotherapy like sorafenib, there should be a beneficial effect, of course. And we are making the induced pluripotent stem cells. That is also one way. But honestly, I am telling, in the throughout the world, people are working in the animal models, and still the clinical trial is very tricky in terms of the cancer microenvironment, because I am telling that this is basically is a degenerative liver. So how much it is liver? So we have to work a lot on the stem cell therapy. Even, of course, CAR T cell therapy is coming, the macrophage therapy is coming, like this our finding and several finding that there is a two kind of the macrophage population present in the liver microenvironment. So one is anti-inflammatory and one is inflammatory macrophage. So if we modulate the macrophage population, because macrophage is one of these good immune cells which is helped recover the liver damage.
Sir, in the last section only we have talked about cancer vaccines, and we know that with the help of vaccine we have eradicated many epidemic diseases like polio and smallpox. But in spite of having vaccines against cancer, why they are not enough for prevention?
Why cancer vaccine is not likely like the polio vaccines or HPV vaccine.
Yeah.
So those vaccines are created based on the antigens come from the virus or something. Now if you think about the cancer cells,
Dr.
or
Biswas,
cancer cannot detect that a single marker or a single receptor is the causing the cancer. So it is detection of the cancer cell is not easy.
Yeah.
That